Hi, this is Jeff DiMaria. This is the Group 3 presentation on renal failure in older adults. At its most basic level, renal failure refers to the kidney's inability to filter waste products and fluid from the blood. It can affect many other body systems and causes high blood pressure, electrolyte imbalance, fluid overload, and poor drug pharmacokinetics, as the kidney is the primary route of drug excretion. It is classified as stage 1 to stage 5 depending on the glomerular filtration rate, or GFR. When talking about failure of the kidneys, we're usually referring to stages 4 or 5. Renal failure can have many debilitating consequences, including death, so it's important for nurses to have a good understanding of it. Our hope is that this presentation will help you identify and comprehend the prevalence, the considerations, interventions, and nursing issues for renal failure in older adults. Secondly, we hope you will learn some strategies for applying this knowledge to daily nursing practice when working with older adults who have renal failure. Not surprisingly, the prevalence of renal failure increases with age, as demonstrated by this chart from the CDC. The most recent data showed the prevalence in ages 65 to 74 is 32%, ages 75 to 84 is roughly 56%, and ages 85 and older is roughly 83%. Other comorbidities that affect the kidneys are diabetes, heart disease, and high blood pressure, as well as obesity and smoking. On a side note, the calculation for GFR and creatinine clearance is inversely proportional to age, so the older you are, the lower those numbers will be. There are many nursing considerations when taking care of an older adult with renal failure. A big one is fluid balance. Patients with severe renal failure tend to be fluid overloaded as the kidneys do not produce adequate urine output. But older adults are also at risk for dehydration, so it truly is a balancing act in terms of deciding to give diuretics or not. In fact, giving diuretics to someone who is dehydrated and not producing urine may actually damage the kidneys further. For nurses, it's important to assess the signs and symptoms of fluid overload, such as increased edema, shortness of breath, and high blood pressure. Another nursing consideration is neurological function, as the buildup of toxins can affect both the central and peripheral nervous systems. This can range from mild confusion to seizures. It can also produce motor function defects, so these patients may need help with ambulation. A third consideration that may get overlooked is immunological condition, as toxin buildup also affects the immune system. Nurses taking care of renal patients need to monitor for signs and symptoms of infection, including skin infections, which we'll get to later, including temperature, white blood cell count, and heart rate. Evidence-based interventions for older adults with renal failure are managing blood pressure, adjusting drug dosing, promoting a renal diet, and then for the later stages, dialysis and palliative care. In terms of blood pressure, most recommendations say that blood pressure should be lowered to 130/80 or less in patients with renal failure. Common medications to treat high blood pressure are ACE inhibitors or ARBs, which both interfere with the angiotensin-renin system. Non-pharmacologic methods to reduce blood pressure include weight loss, reducing dietary sodium, and regular exercise. Drug dosing can be complicated in elderly patients who also have renal failure, as many drugs are excreted by the kidneys. Many drugs should be used cautiously or not at all due to increased risk of drug toxicity. Specifically, antihypertensive, antiglycemics, and opioids need to be reduced to compensate for poor renal excretion. One evidence-based recommendation is to incorporate a 6-step approach to drug dosing for elderly patients with renal disease. This includes obtaining a thorough medical history, assessing renal function, reviewing current medications, individualizing the drug regimen, monitoring for drug effects and toxicity, and finally, going back and revising the regimen when necessary. In renal failure, one of the metabolic waste products that the kidney has trouble filtering is protein waste products called urea, causing them to build up in the blood. For this reason, it is recommended that patients with renal failure restrict their protein consumption to 0.4 to 0.6 grams per kilogram per day. Sodium should be restricted as it contributes to high blood pressure. Phosphorus should be restricted as excess phosphorus contributes to bone weakening, hardening of the coronary arteries, and itching. Also, with the increased risk for fluid overload, patients often are required to restrict their fluid intake to roughly 1,000 to 1,500 milliliters per day. There are no clear-cut evidence-based guidelines on when to start dialysis, as it is usually initiated on a case-by-case basis after all other conservative treatment options have been exhausted. The most recent guidelines from the IDEAL study suggest that dialysis should be considered when the GFR is less than 15, and there is evidence of uremia or fluid overload. Renal failure in the elderly population is often a chronic disease process that is not cured, but rather managed. Therefore, nursing interventions should focus on providing palliative care. A meta-analysis that examined 12 research articles on chronic kidney disease in the elderly emerged with 3 themes. The first is the importance of shared decision-making by the patient and caregivers. This requires approaching each patient individually and communicating the pros and cons of each decision. The second theme is quality of life. Emphasis should be placed on quality of life rather than in attempting to extend life as long as possible. Also, how we define quality of life is strictly a personal definition. Nurses and doctors need to tailor their treatment to the patient's definition. The third theme centers on educational resources. Education is important so that patients can make informed decisions after weighing the pros and cons. Educational resources and opportunities for discussion should be individualized to each patient's cognitive function and level of literacy. There are many nursing issues related to assessment and management of renal failure that are specific to older adults. We will go over 4 of these issues briefly that we felt are important. The first is a problem of polypharmacy. Older adults tend to have more drugs to take anyway, so there is an increased risk for interactions and adverse effects related to toxicity due to the drugs not being excreted properly. This leads to the effects of the drug lasting too long or the dose being too strong for that patient. Questions that we would ask in evaluating a patient for polypharmacy are, do you know what you are taking, and do you know its effects or adverse side effects? Are you taking the drugs as prescribed? And also we should look to see if that dose or regimen is appropriate for that patient. A second nursing issue related to assessment is a dietary assessment. We discussed the importance of a renal diet, but it's often very difficult for patients to stick to such a strict dietary regimen. It's helpful to have a patient keep a dietary journal so that it can be reviewed with each patient visit to make sure that they are making healthy choices. We can also ask patients to state what a healthy renal diet entails for them so that we can assess their comprehension. A nursing issue that often gets overlooked in older adults with renal failure is how renal failure affects the skin. The buildup of toxins such as phosphorus can cause severe itching known as uremic pruritus. It mainly affects the back, chest, limbs, and head, and it's often worse at night. As we know, older adults tend to have very thin skin anyway, so it's important to assess for excoriations, infections, or lesions related to scratching. Finally, a big nursing issue related to management of renal failure in older adults revolves around the psychosocial aspect of living with a chronic disease. For patients undergoing dialysis treatments, the treatment schedules are strict and take long hours. Besides being physically exhausting, these patients may experience depression and hopelessness, knowing that this is what they need to do just to stay alive. They may miss out on traveling or visiting family or friends due to their dialysis treatments. Some may even skip a treatment here or there. But we know that this can be dangerous as there is evidence that skipping just one dialysis session per month has been associated with a 25 to 30% increased risk of death. Our focus as nurses should be on palliative care, positive reinforcement, and education. We can help set up transportation if that is an issue, and we can also include families so that these people can remain socially active. We thank you for viewing our presentation and hope you enjoyed learning a thing or two about renal failure in older adults.